If you've tried painkillers, injections, physical therapy, or even chiropractic care, but you're still dealing with an L4-5 or L5-S1 disc herniation, lower back pain, shooting leg pain, or difficulty walking, there may be one important factor that hasn't been addressed: decreasing the pressure on the injured disc. Research has shown that spinal decompression can help decrease pressure in the lumbar discs and improve back and leg pain. And with my own patients, I've seen significant improvements in movement, mobility, and pain, which has helped them get back to their normal daily activities. In this video, I'll walk you through 5 signs you can use to screen yourself and see if you may be a good candidate for non-surgical spinal decompression. By the end, you'll have a better idea of whether spinal decompression may be right for you. So keep watching. Hi, I'm Dr. Kevin Wafer, a spinal decompression doctor in Houston, Texas. Before we get into the 5 signs, you need to understand what spinal decompression is actually trying to accomplish. A disc herniation is an injury to the spinal disc, and that injury can trigger an inflammatory response. The outer portion of the disc and the nearby tissues contain pain-sensitive nerve endings, and inflammatory chemicals can make these structures more sensitive. That's one reason a disc herniation can cause significant pain right around the lower back. But a disc herniation can also create a mechanical problem. As disc material pushes outward, it may irritate or compress one of the nearby spinal nerve roots. And when that happens, the symptoms can travel beyond your back. You may develop sciatica with shooting or burning pain down the leg, along with numbness or tingling that can extend into the foot or the toes. So we potentially have 2 things happening at the same time: inflammation around the injured disc and a mechanical irritation of a spinal nerve. And that's where spinal decompression comes in. Spinal decompression uses controlled traction to gently unload the affected area of the spine. Research has shown that under certain conditions, this can lower the pressure inside the lower back disc enough to create what we call negative intradiscal pressure. So what does negative pressure actually mean? Think of the disc like a small cushion between 2 bones. When that area is loaded, pressure inside the disc increases. If part of the disc is already pushed outward towards a spinal nerve, that mechanical stress may contribute to irritation around the area. Spinal decompression gently distracts those 2 spinal segments, which can lower the pressure inside the disc. The idea is to create a lower pressure environment within the disc, rather than continuing to load it from above and below. The proposed benefit is that this lower pressure environment may reduce mechanical stress on the disc and the nearby spinal nerves. This is important because if you reduce some of that mechanical irritation around an already inflamed nerve, you may create a better environment for the irritation to settle down and for the nerves to heal. Now, this doesn't mean spinal decompression simply sucks every herniated disc back into place. That's an oversimplification of what happens biologically, and research has not established that decompression reliably shrinks every disc herniation. The goal is to reduce mechanical loading on the area and give the irritated disc and nerve a better opportunity to calm and heal. And that's why spinal decompression may be very effective in relieving back and leg pain that's caused by a disc herniation. But that brings us to the most important question: how do you know if you're a good candidate for non-surgical spinal decompression? These 5 signs may give you a clue. Sign number 1, your back or leg pain hasn't improved with other treatments. Maybe you've done physical therapy, stretching, core strengthening, chiropractic care, or acupuncture. You may also have tried anti-inflammatory medications, painkillers, or even spinal injections. These treatments can be helpful, but they don't work for everyone. And if you have a disc herniation that continues to irritate a spinal nerve, persistent symptoms may be a reason to consider whether a different treatment approach is appropriate. That doesn't mean that because physical therapy or an injection didn't work, spinal decompression automatically will. What it does mean is that if your symptoms have persisted despite appropriate conservative care, non-surgical spinal decompression may be another option worth being evaluated, especially when your symptoms and imaging point toward a disc-related problem. Let me tell you about my patient, Ryan. I first met Ryan a few years ago, and at the time he had been dealing with debilitating lower back pain and sciatica as a result of a disc bulge at L4-L5. Now, before I met Ryan, he had already tried weeks of physical therapy. He'd tried medications. At home, he'd tried ice, heat, stretching, but nothing had helped. And prior to seeing him, he had also undergone 3 rounds of epidural steroid injections, again with no change in his symptoms. He was waking up every morning with debilitating, excruciating lower back pain and leg pain. And as a result of his pain, he had been inactive and had gained over 50 pounds in the last year. Now, after doing a thorough examination and reviewing his MRI reports, I determined that Ryan was a great candidate for spinal decompression. And after just a few weeks of therapy, his pain relief was over 50%. And after continuing treatment for the next couple of months, he was back to living the normal life he wanted. He was waking up without pain, he was able to be more active, playing pickleball, and losing the weight he wants to use. And this is the same thing I've seen in my practice with hundreds of patients that have tried numerous other therapies that hadn't gotten great results, but still got where they wanted to go with spinal decompression. Sign number 2, you have sciatica or pain that travels down your leg. Sciatica can develop when a lumbar disc herniation irritates or compresses one of the nerve roots that eventually contributes to the sciatic nerve. The pain may feel sharp, shooting, burning, or even like an electrical shock. Some people notice it only in their buttock or thigh, while others feel it travel all the way into their calf or foot. When pain travels down the leg like this, it can be a clue that a spinal nerve is involved, rather than the problem being limited to the muscles or joints of the lower back. If a herniated disc is contributing to that nerve irritation, reducing mechanical loading around the affected disc and the nerve is one of the goals of spinal decompression. Sign number 3, you have numbness or tingling in your leg, foot, or toes. A spinal nerve doesn't just carry pain signals. It also carries sensory information between your leg and your brain. When a lumbar disc herniation irritates or compresses that nerve, those sensory signals can become disrupted. You may describe it as pins and needles, buzzing, burning, or an area of your foot that simply doesn't feel the same as the other side. Where you feel these symptoms can also give us a clue about which nerve root may be involved. For an example, an L4-5 or L5-S1 disc herniation can affect nerve roots that provide sensation to different areas of the leg and the foot. So if you have numbness or tingling along with lower back pain or sciatica, especially with a known lumbar disc herniation, you may be a good candidate to be evaluated for non-surgical spinal decompression. Sign number 4. Your MRI shows an L4-5 or L5-S1 disc herniation that matches your symptoms. These are 2 of the most common levels where a lumbar disc herniation occurs. Depending on which nerve root is affected, you may experience lower back pain, sciatica, numbness, tingling, or other symptoms that travel into specific areas of your leg and foot. The important part is connecting what we see on the MRI with what you actually feel. For example, if your MRI shows a disc herniation pressing toward a nerve root, and you have pain and numbness along the distribution of that same nerve, we have a stronger indication that the disc may be contributing to your symptoms. If your examination and MRI findings line up this way, you may be a good candidate to be evaluated for non-surgical spinal decompression. Sign number 5. Back or leg pain is limiting your walking, movement, or daily activities. Maybe you can only walk for a few minutes before the pain increases. Standing long enough to cook a meal becomes difficult. Sitting through a workday or driving for longer periods aggravates your symptoms. Even bending down to put on your shoes can become something you have to think about. When a disc herniation continues to irritate a spinal nerve, pain can change the way you move. You may start avoiding certain positions or activities because you know they'll trigger your symptoms. And over time, that can affect much more than just your back. It can interfere with your work, exercise, sleep, and everyday activities you want to get back to. If a confirmed disc problem is causing persistent back or leg symptoms that are significantly limiting your function, you may be a good candidate to be evaluated for non-surgical spinal decompression. Those are the 5 signs that you can help determine whether you may be a good candidate for non-surgical spinal decompression. We covered persistent pain despite other treatments, sciatica, numbness, or tingling, an L4-5 or L5-S1 disc herniation that matches your symptoms, and pain that is limiting your movement or daily activities. Now, these signs are not a replacement for a thorough consultation and examination by a qualified spinal decompression doctor. That should always be done to determine whether spinal decompression is appropriate for your specific condition. But if several of these signs sound familiar, they may give you a good idea of whether spinal decompression is something worth looking into. Of all of the signs we covered, which one sounds most like you've been experiencing? Was it sciatica that travels down your leg, or numbness and tingling in your foot or toes? Drop a comment below and let me know. If you found value in this video, please give it a like and share it with someone dealing with a lumbar disc herniation or sciatica. Doing that helps more people find practical, non-surgical solutions that may help them move better and feel better. And if you want more videos that help you better understand what is actually causing your pain and what you can do about it, make sure to subscribe to my channel. Now, if you have a lumbar bulging disc and you're wondering whether walking is helping or making your condition worse, go watch this video next. I'll show you when walking can be helpful, when it may aggravate your symptoms, and explain how to walk more comfortably when you're dealing with a lumbar disc problem.